When it comes to diseases, we see that there are different ways it can present. There are different ways that the infection can be manifest, different ways that we will see it presented. A localized infection means that it is there in one place. I have an infection of my hand. I have an infection of my finger. I have, gum infection. Systemic means that it is spreading. It is in one part and it is moving throughout that system. Gastrointestinal, GI tract infection. Starting in the stomach, it's now colonizing my small intestine, my large intestine. Urogenital, it's now, urethra. It's now to the bladder. It's going to the kidneys. Focal, started one place, it's now somewhere else. Mixed infection, well, this is exactly what it sounds. It's mixed infection. You have a localized or systemic infection by more than just one pathogen. You have two or more pathogenic species that are present. A lot of times what we see is what is referred to as primary and secondary infection. Primary, secondary infection. There was an initial infection. It interfered with abilities. It interfered with immune response. It interfered with normal body function, which altered the normal flora in a certain area, which allowed for a second infection. Primary infection is urinary tract infection, E. coli. Urinary tract infection means you're not going to have that flushing action, means, you're not going to be peeing as much, or you're going to be peeing more often, but it's only going to be little amounts. It's going to lead to altered normal flora in the gastrointestinal tract. I'm sorry, not the gastrointestinal, urogenital tract, which is going to then allow for yeast infection. Or maybe it goes the other way. A yeast infection leads to changes in the normal flora, which leads to a urogenital, which leads to a urinary tract infection. Goes both ways. Also have to look at acute versus chronic. Acute means comes, it's there, goes away within a few days, few weeks. Your immune system clears it all the way out. Chronic, you get it, but you never completely clear it. This is a chronic infection. The level of infection may be lower. The inflammation may be lowered from what it was within the first few weeks, but months, year, or more later, you still have this slight infection. You still have this low level of inflammation at the site of the wound, in your lungs, whatever. Table 11.3 here gives a little bit better examples of what I was just referring to. Now, a lot of times we want to use the term, when we're talking clinical cases and things, we want to use the term symptoms for everything. Oh, they had symptoms of fever. They had symptoms. They were feeling bad. That was their symptoms. It's not the correct way to use the term. There are signs, and then there are symptoms. Patient comes into the ER. They're complaining of a headache, malaise. They don't feel good, slightly, dizzy, disoriented. When tested, they show they have a increased temperature. They're having, and their eye movement. They're unable to track. What's the symptoms? What's the signs? Signs are objective things that can be measured, things that you can visually see and you can visually measure. Temperature, the inability to track with their eyes, signs. Symptoms are subjective. I feel bad. I don't feel right. I have a headache. How can you measure a headache? That's why they, on a scale of 1 to 5, how bad's a headache? Scale of 1 to 10, how bad are you? What's your level of dizziness? Those are subjective. Anything subjective, symptoms. Anything that you measure or you can physically look, physically touch, those are signs.